What's up everyone? Dr. Mike here, and today we're counting down the 10 most dangerous medicines you should know about. These drugs can save lives, but they also carry serious risks if not used correctly. My goal isn't to scare you but to empower you with knowledge so you can use these medications safely. Remember, always consult your doctor before making any changes to your medication. This video is for informational purposes only. Never start, stop, or change a medication without professional guidance. Let's jump right in with number 10. Number 10 on our list is Warfarin, also known by its brand name Coumadin. This medication plays a critical role in managing and preventing blood clots. It's a powerful tool, but one that requires careful attention and monitoring. Warfarin is a blood thinner, or anticoagulant, used to prevent the formation of dangerous blood clots within the body. These clots can lead to serious health complications if left untreated. It's often a lifesaver for individuals with conditions like atrial fibrillation, a type of irregular heartbeat that significantly increases the risk of stroke due to clot formation. Warfarin helps to mitigate this risk. It's also commonly prescribed after certain surgeries, particularly those involving joint replacements or other procedures that can temporarily increase the risk of blood clots. However, Warfarin has a very narrow therapeutic window, meaning the difference between an effective dose and a dangerous dose is quite small. This is what makes it a high-risk medication. If the dose is too low, it won't effectively prevent clots, and you risk the potentially life-threatening consequences of clot formation, such as stroke or pulmonary embolism. Conversely, if the dose is too high, you risk severe, even fatal bleeding. This bleeding can occur internally or externally and can be difficult to control. Therefore, patients on Warfarin need regular blood tests, specifically the INR, International Normalized Ratio test. These frequent blood tests are crucial to carefully monitor and adjust the Warfarin dosage, ensuring that their INR levels remain within the target range, keeping them safe and protected. Many things can throw off your INR, making it essential to maintain open communication with your healthcare provider. This includes other medications, both prescription and over-the-counter, as well as certain foods, especially those high in vitamin K, like spinach, kale, and other leafy green vegetables. That's why patient education about potential interactions and the importance of adherence to the prescribed diet, along with close monitoring by a healthcare professional, are absolutely essential for safe and effective Warfarin therapy. Warfarin's power to prevent life-threatening clots, coupled with its potential for serious harm if not managed correctly, make it a drug that demands respect, vigilance, and a collaborative approach between the patient and their healthcare team. Always tell your doctor about any new medications you start taking, including herbal supplements or any major changes to your diet, as these can significantly impact your INR levels and the effectiveness of Warfarin. With careful management, consistent monitoring, and open communication, Warfarin saves lives and prevents serious complications. However, mistakes in dosage or a failure to monitor INR levels can be catastrophic, leading to severe bleeding events or dangerous blood clots. Handle it with care, and always follow your doctor's instructions precisely. Number 9 is fentanyl, a synthetic opioid up to 100 times stronger than morphine. In hospitals, it's a critical tool for severe pain, but its potency makes it extremely dangerous. The difference between a safe dose and a fatal one is tiny. Overdose can cause breathing to stop within minutes. Illicit fentanyl, often mixed into street drugs, is driving the current overdose crisis. Even prescribed patches can be deadly if misused or accidentally touched by children. Fentanyl is a miracle for pain in the right hands, but a tragedy waiting to happen in the wrong ones. Extreme caution is non-negotiable. Number 8 is Digoxin, a heart medication derived from the foxglove plant. It helps with certain heart failures and arrhythmias, but the line between a helpful and a toxic dose is razor thin. Toxicity can cause nausea, confusion, vision changes, and deadly heart rhythms. Older adults and those with kidney problems are especially at risk. Low potassium levels can make digoxin even more dangerous. Because of these risks, its use has declined, but it's still vital for some patients. Regular blood tests and monitoring are a must. Even natural medicines can be deadly if not used carefully. Digoxin is a classic example of handle with care. Number 7 is Clozapine, a last-resort antipsychotic for treatment-resistant schizophrenia. It can be life-changing, but it carries a rare, potentially fatal risk of granulocytosis, where your immune system is wiped out. Patients must undergo frequent blood tests, weekly at first, to monitor white blood cells. Pharmacies won't dispense it without proof of safe blood counts. Clozapine can also cause seizures, heart inflammation, and major metabolic issues. Its risks are high, but for some, the benefits outweigh them, if strict monitoring is in place. This drug is a lesson in balancing hope with vigilance. Only use under expert supervision. Number 6 on our list of high-alert medications is Methotrexate. This is a medication that demands respect and careful attention due to its narrow therapeutic window and potential for serious adverse effects. It's a drug used in high doses, often as part of aggressive chemotherapy regimens for various types of cancer. In these situations, it works by inhibiting the rapid growth of cancerous cells. But it's also used in low doses for autoimmune diseases like rheumatoid arthritis, psoriasis, and lupus. Here, it acts as an immunosuppressant, helping to calm down an overactive immune system that's attacking the body's own tissues. The biggest danger with methotrexate? The dosing schedule. It's a critical factor that separates safe and effective use from potentially life-threatening toxicity. For autoimmune conditions, the standard protocol is a single dose, administered just once a week. This allows the body to recover and minimizes the risk of cumulative toxicity. Taking it daily by mistake instead of weekly can quickly lead to a dangerous overdose and can be fatal. This is not an exaggeration, it's a very real and preventable risk. An overdose of methotrexate can lead to severe consequences, including bone marrow failure, where the body stops producing essential blood cells. It can also cause painful mouth sores, a condition known as oral mucositis, making it difficult to eat or drink. Because methotrexate suppresses the immune system, it significantly increases the risk of serious infections. And in severe cases, an overdose can result in irreversible organ damage, affecting the kidneys, liver, and lungs. Even when taken at the correct doses, long-term use of methotrexate can still harm the liver, potentially leading to fibrosis or cirrhosis. It can also damage the lungs, causing a condition called pulmonary fibrosis, which makes it difficult to breathe. Therefore, regular blood tests are absolutely essential to monitor liver function, kidney function, and blood cell counts, allowing doctors to catch any problems early and adjust the dosage accordingly. Despite these risks, methotrexate is a miracle drug for many people suffering from cancer and autoimmune conditions, providing significant relief and improving their quality of life. However, it's crucial to remember that a simple dosing error can have deadly consequences, turning a helpful medication into a dangerous poison. Always double-check your dosing schedule before taking methotrexate. Use a pill organizer, set reminders, and involve a family member or caregiver to help you stay on track. Never hesitate to ask your doctor or pharmacist if you're unsure about anything related to your methotrexate prescription. They are your partners in ensuring your safety and well-being. With precision in dosing and careful monitoring by healthcare professionals, methotrexate can be a safe and effective treatment. But remember, there's absolutely no room for error when it comes to this medication. Pay attention to the details on your prescription label, understand the instructions, and take ownership of your medication safety. Your life depends on it. Number 5 is Isotretinoin, or Accutane, the most effective treatment for severe acne. It's a game changer, but it's a powerful teratogen. If taken during pregnancy, it causes devastating birth defects. The iPledge program requires strict birth control and regular pregnancy tests for anyone taking it. There are also concerns about mental health side effects, so mood monitoring is important. Other risks include liver damage and severe dryness. Isotretinoin can transform lives, but only with strict safety protocols. Never take it without full understanding of the risks and requirements. This is a drug where rules save lives. Number 4 is Amiodarone, a powerful antiarrhythmic for life-threatening heart rhythms. It's a last resort drug because of its long list of toxicities. Amiodarone can scar the lungs, damage the liver, and disrupt thyroid function. It can even cause vision changes and turn your skin blue-gray. Ironically, it can also cause dangerous heart rhythms. The drug lingers in your body for months, so side effects can appear long after stopping. Patients need regular blood tests, chest x-rays, and eye exams. Amiodarone is effective, but the risks are real and require constant vigilance. It's a weapon. Use only when absolutely necessary. Number 3 is Thalidomide, a drug infamous for causing birth defects in the 1950s and 60s. It led to thousands of children born with severe limb and organ malformations. Today, it's used for certain cancers and leprosy complications, but under the strictest controls. The Thalidomide REMS program enforces pregnancy prevention and education. Thalidomide's story is a warning: even safe drugs can have hidden dangers. Its modern use is tightly regulated, but its history changed drug safety forever. Always approach new medications with caution and respect. Lessons learned the hard way save lives today. Number 2 is chemotherapy, not a single drug but a class of cancer-fighting agents. Chemo targets rapidly dividing cells, killing cancer but also harming healthy cells. Side effects include anemia, infections, bleeding, mouth sores, nausea, and hair loss. Some chemo drugs can damage the heart, kidneys, or nerves. Dosing is a delicate balance, enough to fight cancer but not so much it destroys the patient. Oncologists monitor patients closely to manage these risks. Newer targeted therapies are emerging, but traditional chemo remains essential and dangerous. It's a controlled risk, taken for a chance at life. Chemo is proof that sometimes, the cure is almost as tough as the disease. Number 1 on our list of dangerous medications is insulin. It's a critical hormone, often the cornerstone of treatment for millions living with diabetes around the world. It's a hormone that millions rely on daily for managing their diabetes, helping them to regulate their blood sugar levels and live full, active lives. Without it, the consequences can be severe. It's life-saving, a true medical marvel that has transformed the lives of countless individuals. But here's the catch. Even a seemingly small dosing mistake can have fatal consequences. The difference between a therapeutic dose and a dangerous one can be surprisingly narrow. Too much insulin, or conversely not enough food to balance the insulin dose, can quickly lead to a dangerous condition called hypoglycemia. Hypoglycemia means dangerously low blood sugar levels, a state where the brain and other vital organs are deprived of the glucose they need to function properly. The symptoms of hypoglycemia can range from mild shakiness and sweating, to more severe manifestations like seizures, loss of consciousness, coma, and tragically, even death. Adding to the complexity, there are many different types of insulin available, each with its own unique onset, peak, and duration of action. Confusing these different types of insulin is a surprisingly common and potentially deadly error, highlighting the need for careful attention to detail. Even a seemingly small difference of just a few units can have dramatic and potentially life-threatening effects on a patient's blood sugar levels. Tragically, insulin errors are among the most frequent types of medication errors reported, and they are also among the most serious, particularly within the high-pressure environment of hospitals. For individuals managing diabetes with insulin, it's a daily balancing act, a constant tightrope walk between maintaining healthy blood sugar levels and avoiding dangerous highs and lows. It's undoubtedly a miracle drug, offering a lifeline to those who need it. But it's crucial to remember that the margin for error is razor thin, demanding respect, vigilance, and meticulous attention to detail. That's why insulin tops our list of dangerous medications. It's so widely used, so commonplace, and yet mistakes in its administration can have such devastating and deadly consequences. That's our list, the 10 most dangerous medicines you should know about. Each is powerful, life-saving, and risky if misused. The key is knowledge, vigilance, and open communication with your healthcare team. Always ask questions and understand your medications. Responsible use saves lives. Thanks for watching. Stay healthy, stay informed, and subscribe for more evidence-based health info. See you next time.